Hello and welcome to our video presentation. My name is Raquel, and today I will be walking you through CalPERS health benefits for members who work for a public agency or school employer. Also, a quick note before we begin. This presentation is only for public agency and school members. If you are a state or California State University member, this video does not apply to you. We offer a separate presentation specifically for state and CSU employees. To begin, here's a couple of housekeeping items. We've provided a presentation notes and resources document to help you follow along and reference later. You'll find the link for the document in the YouTube description box. We won't be responding to questions during the presentation due to the large number of participants. If you have questions, please contact us directly. With that, let's get started. In this presentation, we'll cover what a public agency or school member means, health types and eligibility, employer contributions, health resources, and our online tools and health resources available to you. Now let's cover what we mean by CalPERS public agency and school members. Who are public agency employees? They are grouped into two categories of CalPERS membership: local miscellaneous and local safety. Now, who are local miscellaneous employees? They are members of a county office of education, school district, or community college district, and have contracted with CalPERS, except local safety members. Local safety members are employees, which includes all local police officers, local sheriffs, firefighters, safety officers, county peace officers, and have contracts with us. Let's now discuss our school members. You're a school member if you're in a classified, non-certificated position within the jurisdiction of a K-12 school or community college employer. You are also a school member if you're in one of the following staff positions: administrative, technical and support staff, bus drivers, or custodial. If you have questions about your CalPERS membership, please contact your employer. With that, let's dive into health types and eligibility. In this section of our presentation, we will be discussing the following: the health benefits officer role, our different health plan types, and eligibility and enrollment while you're working or in retirement, which will be coupled with our health publications. Let's start with Health Benefits Officer, or HBO. Each employer has a health benefits officer, your main contact for health benefits. The HBO provides information on the following: enrollment and eligibility, plan costs, employer contributions, and processes all health benefit enrollments and changes. While you're employed, your employer's personnel office serves as your HBO. After retirement, CalPERS becomes your HBO. Let's move on to our health plan types. CalPERS offers health-eligible members several types of health plans to choose from: Preferred Provider Organization, or PPO, Health Maintenance Organization, or HMO, Exclusive Provider Organization, or EPO, and Association plans. The type of plan you choose will determine how much you pay out of pocket and what doctors you can visit. So what is a Preferred Provider Organization, or PPO? A PPO plan allows you greater flexibility when choosing your healthcare provider, which many members find beneficial. We offer the following PPOs: PERS Platinum, which is available nationwide, or PERS Gold. Let's cover some key areas to remember. Your maximum copay or coinsurance is less when you stay in-network for services. You can see a specialist and access many types of services without a referral. While you'll be matched with a primary care provider, you can choose not to go through them for care. You pay for services until you meet your deductible. And after meeting your deductible, you pay coinsurance, which is a percentage of the costs. In-network services are generally cheaper than out-of-network services. Next, there is the Health Maintenance Organization, or HMO. What's an HMO? An HMO plan includes a network of providers such as doctors, medical groups, hospitals, and labs that you must go through to receive care. We offer the following HMOs: Basic non-Medicare plans include Anthem Blue Cross Select and Traditional, Blue Shield Access Plus and Trio, Kaiser Permanente, Sharp Performance Plus, United Healthcare's Signature Value Alliance, United Healthcare's Signature Value Harmony, Western Health Advantage, and HealthNet Salud y Más. Key points to remember. You'll have a primary care doctor who manages your care. If you need to visit specialists or get tests, your primary care doctor will make the referral or request authorization. There is usually a copay for most services. And lastly, an HMO has a geographically restricted service area, so availability of HMO plans is based on your home or work zip code. Third, our exclusive provider organization, or EPO, falls somewhere between an HMO and PPO. It provides the same covered services and lower costs of an HMO, along with a broad network and some of the flexibilities of a PPO. We offer the following EPO: Blue Shield Access Plus EPO. Key areas to remember. You pay copays, but you don't pay deductibles or coinsurance, like you would in a PPO plan, so your overall out-of-pocket costs may be lower. You're required to obtain care from the plan's network of preferred providers. If you receive care out of network, you're required to cover the full cost of services, except for emergency medical care. You'll be matched with a primary care provider, but you do not need a referral to see a specialist as long as they are within the preferred provider network. Finally, we have the association plans. Here are the 3 association plans. Anthem Blue Cross for California Association of Highway Patrolmen, CAHP employees, Blue Shield of California for California Correctional Peace Officers Association, CCPOA employees, and Anthem Blue Cross for Peace Officers Research Association of California, PORAC employees. You must belong to the specific employee association and pay applicable dues to enroll in the appropriate plans. Visit their websites for more detailed information, and remember, you can use our health plan search by zip code tool available on our website for more personalized information. Be sure to check the following to make sure the plan is available to you. Contact member services to ask if your preferred doctors are available. Confirm the provider network is accepting new patients in your area. Review benefits on the health plan's website. Log in to your CalPERS account and use the Search Health Plan tool to compare coverage for you and your family. And lastly, make sure your zip code is included in the plan's coverage. Here are the health plans available for active members: Anthem Blue Cross, Blue Shield, HealthNet of California, Salud y Más, Kaiser Permanente, PERS Platinum Basic Plan, PERS Gold Basic, Sharp Health Plan, United Healthcare, and Western Health Advantage. Visit your health plan's website to review your benefits, claims process, payment details, and any service limitations or exclusions. Remember, be sure to log in to your CalPERS account and use the Search Health Plans tool to compare coverage and benefits for you and your family. Next is our health plans available for retired members: Anthem Medicare Preferred, Blue Shield Medicare, HealthNet of California, Salud y Más, Kaiser Permanente Senior Advantage, Kaiser Permanente Senior Advantage Summit, PERS Gold Supplement to Medicare Plan, PERS Gold Medicare PDP, Sharp Direct Advantage Medicare, United Healthcare Group Medicare Advantage, and lastly, Western Health Advantage. Again, visit your health plan's website and then log in to your CalPERS account and use the Search Health Plans tool to compare coverage and benefits for you and your family. It's important to note that some health plans are only available in specific counties or zip codes. And as a reminder, before enrolling, confirm with the health plan that your zip code is covered and that their provider network is accepting new patients in your area. You can also use our online health plan search by zip code tool. As an active CalPERS member, eligibility isn't based on your job classification. To qualify for CalPERS health benefits, you must be appointed to a job that will last at least 6 months and 1 day. You must work at least half-time, have 60 calendar days from your appointment date to request enrollment, and you must work for an employer who has contracted with CalPERS to administer their health benefits program. Also, the Affordable Care Act, or ACA, may expand eligibility for certain variable hour employees. For details about your health eligibility, enrollment, and premiums, contact your employer. You should also visit your health plan's website to review your benefits. As a CalPERS retiree, to be eligible for our health benefits enrollment, you must meet all of the following requirements. Retire within 120 days of the date of separation from employment. Receive a monthly retirement allowance from a public pension system, such as CalPERS or CalSTRS. Be eligible for health enrollment on the date of separation. And lastly, you must have retired from an agency that elects to contract with CalPERS for health benefits for their specific bargaining unit. Now that we've talked about your health plan types available and eligibility and enrollment, let's briefly talk about employer contributions. Employer contributions are established by contract, and each employer can change the contract. Be sure to check with your employer to see how much they will contribute for health. Before we move on from employer contributions, we wanted to discuss COBRA, or the Consolidated Omnibus Budget Reconciliation Act of 1985. This is a federally mandated program for employers with 20 or more employees to allow the continuation of identical health and dental coverage for a limited time under certain circumstances when coverage terminates for an employee and/or dependent. COBRA allows you to continue health coverage for yourself and your dependents if you involuntarily lose your health benefits. Coverage must be continuous, and you'll be required to pay premiums from the date your CalPERS coverage ended. You must submit a COBRA election form within 60 days following notification of eligibility, and your premium cannot exceed 102% of the group monthly premium rate. We've gone over a lot today. Let's go ahead and cover a few helpful tools and resources to help you learn more about your CalPERS health benefits. For active members, visit our health benefits webpage to learn more about Affordable Care Act, or ACA, eligibility and enrollment for active members, Medicare, open enrollment for active members, and plans and rates for active members. Please note that long-term care has been suspended as an open enrollment option. For retired members, visit our health benefits webpage to learn more about Complementary Annuitant Premium Program, or CAPP, Dependent Eligibility Verification, Eligibility and Enrollment for Retirees, Medicare, Open Enrollment for Retirees, and lastly, Plans and Rates for Retirees. In your MyCalPERS account, the Health Plan Summary page provides details regarding the following resources: Health Summary, Search Health Plans, Health into Retirement Calculator, if applicable, Open Enrollment, and Health Vesting. Under the Forms and Publications section on our website, you can download or view the Health Benefit Summary, which explains the differences between HMO and PPO plans, the Health Program Guide, which covers basic and Medicare health plan eligibility, enrollment, and choices, and lastly, the Medicare Enrollment Guide, which covers how Medicare works with your health benefits and when you need to enroll in a CalPERS Medicare plan. Now, to close out our time, I want to mention that this presentation, along with many of our other videos, is available on our YouTube channel. You can get to it through calpers.ca.gov or by visiting youtube.com/CalPERS. Thank you so much for joining us today for our presentation on health benefits for public agency and school members. We hope you found the information helpful. If you'd like to learn more or dive deeper, we encourage you to check out our member education classes. You can sign up for these through your MyCalPERS account under the Education section. Just a quick reminder, CalPERS is governed by the Public Employees Retirement Law. The details we've shared today are meant to give you a general overview, but the law itself is pretty complex and can change over time. If there's ever a difference between what you hear in our presentations and what the law says, the law will always take priority. Later today, you'll get an email with a short evaluation. We'd really appreciate it if you could take a few minutes to share your feedback. Your feedback helps us improve our presentations. Thank you again for spending part of your day with us. Have a wonderful day.